तक और इंडिया टुडे
देख लेना बहुत जरूरी है, लेकिन अगर वीडियो देखते हुए ब्रेक आए मजा नहीं।
is traded at any given time. Senator Inhofe says the exact same thing as well, and they insist that it has nothing to do with the coronavirus. But perhaps the most serious allegations are against Senator Burr and Senator Loeffler. Loeffler's husband is the chairman of the New York Stock Exchange, and so that raised a lot of questions as well on that end. She says that there is that everything she's saying is transparent, and that she'll be happy to answer questions, but she hasn't answered all of our questions yet. As far as Senator Burr is concerned, he is saying that the ethics investigation here in the committee here in the Senate should open an investigation into him. So he called on to an investigation into himself. We have not seen Senator Burr around Capitol Hill at all today. But what's also interesting is that no Republican has really come out and defended either one of them. We've asked Majority Leader Mitch McConnell about it. He declined to answer. No one has come to their side at this point. So we'll see where this goes, because at best, the appearance looks horrible, Allison.
Yeah, absolutely. And I know you'll keep asking the tough questions and get to the bottom of this one. Thanks so much. Stay healthy. Stay safe.
You too.
Thanks.
Breaking news tonight, the coronavirus forcing millions more Americans into virtual lockdown. Over 75 million people in New York, California, Illinois, and Connecticut ordered to stay at home. The U.S. borders to Mexico and Canada set to close to non-essential travel. A spring break crackdown. Florida communities closing beaches. In Europe, the crisis growing inside the ICU in Italy, the country's deadliest day. Fear on the front lines. ER doctors saying we are on the verge of a medical disaster. Healthcare workers' lives at risk.
There's a lot of anxiety. There's a lot of fear. There's a lot of, wondering if you're risking your life by going to work.
Critical shortages of life-saving equipment. President Trump invoking war powers to order private companies to manufacture supplies. New developments on that $1 trillion relief plan. How soon Congress could approve those checks for you. The staggering rise in unemployment. People out of work lining up for free meals. The healthcare crush. Vital treatments delayed. Our correspondent battling cancer, feeling the impact firsthand. The surge in students learning from home. Over 50 million taking lessons online. But what about the kids without internet access? And does the coronavirus present a bigger risk to pregnant women?
This is NBC Nightly News with Lester Holt.
Good evening. It was just a little over 10 days ago we were all shaking our heads at news that Italy was locking down the entire country to stop the spread of COVID-19. Awful, we thought. But it couldn't happen here, except it slowly is. State by state, residents now being ordered to stay indoors. Non-essential businesses told to close. The latest, Connecticut, as the wave of sickness appears to be following the grim predictions. Again tonight, our team is going to explore the facts, the ramifications, and what our leaders are doing to protect us. We start with Miguel Almaguer.
Tonight, the governors of New York, California, Illinois, and Connecticut taking drastic and historic action. Residents of multiple states told to go home and stay home as the coronavirus crisis explodes across the nation, affecting at least 76 million people. The orders, which if violated could include a civil fine, means all non-essential businesses must close, while places like grocery stores, gas stations, and mass transit continue to operate. Going out to pick up food or supplies or solitary exercise like a walk or hike are permitted.
And when I talk about the most drastic action we can take,
This is the most drastic action we can take.
As the number of confirmed cases skyrockets in New York, in California, the most populated state in the nation, they have doubled. In a letter to Congress, Gavin Newsom is requesting $1 billion to fight the virus and asking for the USNS Mercy, a floating hospital, to dock in Los Angeles.
This is a moment where we need some straight talk, and we need to tell people the truth. We need to bend the curve in the state of California.
With California bracing for 20% of those infected with the coronavirus to be hospitalized, in Washington state, where the death toll is the highest, officials say they are preparing to ration health care, including ventilators.
The notion that this could happen in America, where we can see something coming and we can't get the resources here to avert it, is ridiculous. It should not happen.
In uncharted territory, today the U.S. government extended the federal tax deadline 90 days, the first time in history, hoping to ease the financial burden on all Americans. With both the Mexican and Canadian borders closing to non-essential travel, the CDC is worried Border Patrol agents face a serious risk of becoming infected. The crackdown on large groups spreading coast to coast. Orange County, Florida, which includes Orlando, will have a curfew beginning tonight. Kerry Sanders is across the state.
The conflicted images of states like California that are shut down, while here in Clearwater, Florida, spring break continues, has finally hit a breaking point. This beach will close down tonight, and already some college kids seem to be getting the message, packing up, heading home.
Just 4 months away from the Tokyo Olympics, USA Swimming is now officially calling for a one-year postponement of the Games. Facing a new reality, tonight we are all reminded of what's at stake. This, the changing face of a nation, perhaps more connected than we are apart.
The U.S. Olympic Committee says it's premature to make a decision about the Summer Games. As for that go-home order here in California, it's open-ended, but the mayor of Los Angeles says it could last upwards of 2 months. Lester?
All right, Miguel, thank you. And at the nation's hospitals tonight, a worsening situation as doctors and nurses try to save lives, increasingly without the protective gear and equipment they need. Tom Costello has the latest.
The warning from the nation's frontline ER doctors, the situation is critical.
What we're dealing with right now is something most of us in our careers have never seen, which is a slow roll mass casualty incident.
With doctors and nurses running low and now reusing personal protective equipment, communities are stepping up and making masks. New York City is warning it will run out within 2 weeks. UMass Medical near Boston says it's a matter of days.
Right now, our number one priority is getting those N95 masks, and the gowns would be number two. Gloves and eye shields will be right behind it as well.
Also in high demand, ventilators for the most critically ill patients.
We need those ventilators.
وإن يك كاذبا فعليه كذبه وإن يك صادقا يصبكم بعض الذي يعدكم إن الله لا يهدي من هو مسرف كذاب يا قوم لكم الملك اليوم ظاهرين في الأرض فمن ينصرنا من بأس الله إن جاءنا قال فرعون ما أريكم إلا ما أرى وما أهديكم إلا سبيل الرشاد وقال الذين